Hi everybody, my name is Lulu Achwo. I am going to be talking about oxygen administration. Before ever administering any medication or treatment, you have to first of all verify the order. So in the process of oxygen administration, I'll first of all verify the order, explain the different reasons a patient might need oxygen administration. I make sure I provide privacy to my patient. I do hand hygiene by washing my hands. I introduce myself to the patient, and I also explain the procedure that I'm going to be carrying out with the patient. After doing that, I gather my supplies or equipment. With all of that, I also make sure I identify the patient with the two forms of identifiers, which is asking them to tell me their names, the first and last name, and the date of birth. While they do that, I verify with their armband to make sure it's the right patient I am dealing with. After the identifiers, I will perform initial respiratory assessment with an oximeter, and I assess the current oxygen use level. I make sure I explain the purpose for which the patient is going to be using the incentive spirometer to the patient, explain how to perform the procedure to the patient, and I make sure the oxygen the device is the right one for the patient, the right one that was prescribed by the doctor, and then oxygen delivery. That's the oxygen delivery device should be the right one for the patient, and the nasal cannula with one that fits the device as well, and I will identify the nasal cannula. I verbalize the oxygen flow rate to the patient so that they are aware of what they're receiving and the quantity that they're receiving. Let's say, for instance, it's like 2 liters per hour or 2 liters per 4 hours. For example, the patient has to be aware they are receiving 2 liters. If it is a face mask the patient is going to be using, I have to identify the face mask, the type of face mask. I verbalize the flow to the patient. I verbalize the proximity to the patient. And if in the case of the non-rebreathable mask, I also have to identify the non-rebreathable mask. I will verbalize the flow to the patient, and I'll verbalize the proximity as well. So with all of the different types, the patient has to know what they're using, what type is it, and the flow rate that they are on. And then when all is done, I will make sure I document what was done, what explanation was given to the patient, and if the patient did understand the procedure or not. I have to document all of that, and the flow rate and all of that needs to be properly documented. Thank you.